What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video we're covering top tips and innovations you do on the battlefield, in the ER, or anywhere doing portables, x-rays. So, top innovations. Let me give you the game. This is your, let's imagine, this is your x-ray cassette, right? Patients, one of the common ones. A foot, right? So usually you'll have the patient, like, it'll be kind of this, they place their feet, right? Sometimes, depending on what condition or it's broken, patients will be like, is this okay? And then you're like, well, I can angle the tube so much, and you'll shoot it and it'll still look bad. So if you don't want to hold it, or you've already gotten exposed, radiated too much, the goal is to match the angle as best as possible. So if the foot is kind of like lifted up, is lifted up, essentially you can grab something. Well, the most common one is to get a glove box or a little bacterial wipe and prop it up here to compensate it. So now instead of the feet floating, it will match it, and then you just adjust your tube accordingly to make it look perpendicular. That is a very infamous situation of innovation that occurs. Same thing with like fingers or feet. If they can't get them out of the way, sometimes you get a good old rubber band / the thing they use for IVs, the little blue band. You just wrap up the fingers and just, if they're not hurting, that's something. Or like put a little gauze, put a little something to get the fingers out of the way. That's another one. Sometimes you will literally have the patient hold it against, like, let's say their knee. If they can't fully lateral, you just have like prop it up against the rail and you just kind of cross table it in a way. You have that way. Other times, sometimes you will have to literally let up, hold it, and be holding the button and the tube at an angle and like do the whole spiel. Like it will get very innovative just to get the certain angle. Because sometimes you'll be like, if it's a post-process, sometimes their hand is like angled up. So sometimes you'll have to like put the tube in a way, let's say it's a cross-table hip. So if it's a big patient, sometimes you have to grab something like a chair or whatever's in the way, a table, to prop and hold the board essentially on one side with like pillows or whatever is fair game you can find in that room to hold the board if the patient can. And then you over here manipulating the tube to get the best. Sometimes the doctor or whoever's around will laugh, but it gets the job done, and it reduces your exposure of like us getting exposed. So literally, it's almost fair game. Sometimes I almost feel like you need to carry little wedges with you, but a little box of like gloves, the little square ones, they'll get the job done. They'll help a lot. And yes, but we go. See you on the next.